The next 3 sessions in the series are on pharmaceutical interventions to manage pain in older adults. These sessions will be led by Julia Barham, pharmacist and academic detailer with RX Files Long-Term Care Project. Thank you, Julia.
This session will cover an overview of general principles to consider when using medication to treat chronic, non-cancer pain in older adults. The learning objectives are, first, to understand the goals of therapy when using medications. Secondly, to describe how to optimize treatment with pharmaceuticals. And third and finally, to understand the various factors that can affect pain relief with medications. Refer to LexiComp at the web address on the screen for more information about these medications. For people with long-standing pain, the elimination of pain with medications may not be a realistic goal. For most people, the reduction of pain by 30 to 50% and improved function are more realistic goals. To optimize the treatment of pain, both pharmaceutical and non-pharmaceutical interventions should be used simultaneously. A careful dosing strategy is recommended, starting with a low dose or longer dosing interval, but titrating up based on therapeutic response and tolerability. In other words, start low and go slow. Be alert for potential adverse effects when multiple drugs with central nervous system or cognitive side effects are used together. For example, combining a benzodiazepine, such as lorazepam, with an opioid, such as morphine, should be avoided if at all possible. Check in with the client every 3 to 7 days after initiation of a new medication or dose change to evaluate if delayed adverse events have developed. Use the least invasive route of administration. The oral route is most commonly used. However, swallowing difficulties may require the medication to be applied topically or administered by injection. Both older adults and their family members require education regarding what to expect with the pain medication they are receiving. Encourage older adults and family to ask questions and do your best to address all of their concerns. Clients may ask how long it will take for a medication to start working. There's no single right answer to this question, as many factors play a role. There are numerous medications available, each with a unique active ingredient and formulation. As a result, each separate medication will have a different onset and different duration of effect. As we age, gastrointestinal motility slows, and renal and hepatic functions change. This can delay the onset of effect for a medication or increase how much of the medication enters the bloodstream and prolong the effects of medications. A medication's formulation plays an important role in its onset and duration of effect. Slow-release oral formulations may take 1 to 2 hours to be released into the bloodstream. While onset may be slower, the duration is prolonged, often exerting an effect for 12 to 24 hours. Slow-release formulations can often be identified by their name. They may contain abbreviations such as CR, which stands for controlled release, SR, which stands for sustained release, XL, which stands for extended release, or possibly include the term cotton. But they don't always contain these terms, so it's important to know if you are using a slow-release product, as it will affect how the older adult should take the medication. Immediate release medications may only take 30 to 60 minutes to be released into the bloodstream. In older adults, the effect generally takes longer to be realized due to the slower physiological processes that occur with aging. Immediate release products may last anywhere from 4 to 24 hours, depending on the individual receiving the medication. The immediate release formulations are often, but not always, denoted with the IR abbreviation. When not using the oral route of administration, injections and topical applications may be used as an alternative option. Subcutaneous or sub-Q formulations generally take effect within 15 to 30 minutes. Some sub-Q injections may last a few hours, while others may last a few weeks. Medications that are available as topical preparations may take about 5 hours to exert their full effect, but an initial application may provide some relief or possibly cause some discomfort if the area is tender to touch. Most topical products are from the anti-inflammatory medication class, and these medications may require days of application to reach their optimal effect. Patches are another route for administration of pain medications. Fentanyl and buprenorphine are both available as patches, but may take 3 days to reach a steady state in the body. Fentanyl patches start to exert an effect 6 hours after application. Once a patch is removed, the medication remains in the body for up to 5 days. This is an important fact to remember when switching from a patch to the oral route. Reassess the older adult's pain after an appropriate period of time depending on the route of administration. For example, after giving an oral medication, reassess pain and check for adverse events within 1 hour. For injectable medications, reassess the pain within 15 minutes to ensure that treatment was effective and no immediate adverse events have developed. For individuals with swallowing difficulties, some oral medications may be crushed, split, or opened. Check with a pharmacist or the product monograph to ensure this is safe. Generally speaking, slow-release oral products cannot be altered, as this could result in a bolus of the medication reaching the blood all at once with potentially fatal effects. Medications that are available as orally disintegrating tablets, liquids, patches, or injections should be considered before crushing a tablet or opening a capsule. Medication should be administered on a regular schedule if pain is continual and ongoing. As-needed dosing, or PRN dosing, is most appropriate for breakthrough pain when someone is already taking a regularly scheduled pain medication or for acute short-term pain. However, for someone with chronic pain, PRN dosing should only account for a small proportion of the total daily dose. If PRN dosing is occurring regularly to manage breakthrough or end-of-dose pain, the scheduled medication dose should be reevaluated and likely increased or changed. To summarize, the complete resolution of chronic pain is not often a realistic goal of therapy. Aim for a reduction in pain of 30 to 50% and an improvement in function. Pharmaceuticals and non-pharmaceutical measures should be used together and must be used cautiously in older adults. Remember, start low and go slow. Pain medications vary significantly in terms of their formulations, onset of effects, and duration of effects. Be sure to understand all these differences to optimize treatment.